thank you very much for being here. I'm super happy to present Lumias to you guys. It's our employee mental health platform for your employees and their whole families. So what's the situation today? We looked at the situation in UK, and it's very similar to the situation in Germany. So we see that poor mental health is the leading cause for work absence or sick days in UK, and that costs British companies £43 billion a year. And the number is rising, and these numbers are increasing by 31% here in UK. We also looked at the situation with kids and youth, and this is very similar, and the numbers are on an alarming high. We see that 1 in 6 children have a mental health problem, and 400,000 children a month are being treated here in the UK for poor mental health. That's quite a high number, and the numbers in Germany are similar. So maybe just shortly to the psychological background. How can mental health issues develop, and how can we prevent them and treat them effectively? And our answer is definitely with emotions. So you can say we are shaped by our emotions from the first hour of our birth. These kind of programs or behavior patterns, they control our thinking, acting, and feeling throughout our whole lives. And changes of these patterns usually require a little bit more than just a logical explanation. A smoker, for example, knows smoking is very bad for him and his health, but he can't help and needs to smoke when there's a stressful situation, because maybe the cigarette was one day connected to a very positive feeling of maybe feeling, I don't know, feeling free or feeling sexy, feeling independent. And if this person has stress, the body or the brain looks for a program in the brain to lower the stress hormones, and then it might find a cigarette as a program to give him happy hormones and balance the stress. So this is how it works. And on a rational level, we can treat symptoms short term, but to treat these kind of issues on a long-term basis, we need to establish new emotional programs to really work with that lastingly. And this is what we do. So we've created an emotional training consisting of emotional spoken scenes or emotional meditations where film composers composed classical film music onto each scene. And this music was recorded with big symphonic orchestras, the Berlin and Budapest Symphonic Orchestra. So we really want to have the same effect as watching a very emotional film where you're drawn into the story and feel with the protagonist. You can laugh with them, you feel happy with them, you can cry with them because of the story and the music. And this is what we want to create here with Lumias as well. So we created this program consisting of words and music, and that's why we can go a little bit deeper and change the origin of mental health problems for giving them a new emotional information in the brain. And this works for adults as well as for children to overcome anxiety, stress, depressive moods, sleeplessness, as well as addictions. For example, obesity. We can work very effectively with obese patients because that is often also an emotional or a psychological problem. And on the other hand, we can strengthen self-confidence, trust, the feeling of being loved, being wanted, having a purpose in life. So we are the founders. Myself, my name is Verena Herzog-Pohl. I have founded 2 other companies beforehand. My background is in film and media, and I also have an IT security company. And on the other side, you see my mother, who is 73, and she is the initial founder of the Herzog Method because she was a patient herself one day. She was suffering from depression, she was suffering from obesity. She went to several doctors, therapists, took a lot of medication that helped her along on a short term. And when she stopped that, it took quite a while, and then she went back to where it was before. So she said, my brain was just conditioned in a wrong way, And there must be a way to condition that back and not just going back and forth to doctors and psychotherapists taking medication for the whole of my life. So she developed this method and studied a lot about emotional science, brain science. She wrote books about that, which were best-selling books in Germany. And she worked with insurance companies, scientists, psychotherapists, and doctors. And we also, we worked to use some voices from the scientific sides. We have a pilot study together with the Max Planck Institute of Psychiatry in Munich. I know it's only a pilot study with a small sample of people, but still, they collected data for over 2 years, and they focus on our program against obesity. And after 10 months, listening to our trainings tracks for 10 minutes a day, all of the patients lost weight, effectively 16 kilograms in average. And then they stopped listening after 10 months. And then the Max Planck Institute took data after 2 years again. And what was very fascinating was that none of the patients regained weight. And even 40% of the patients further lost weight and averaged 29 kilograms. And that was really, really fascinating for the scientists because they said that's a hint that we can really change something in the subconscious mind and change behavior patterns and not just treat the symptoms. And this is our app. So what we offer to, for example, for corporates, for their employees, is we offer seminars online or on-site, group follow-ups, and also one-to-one sessions with trained psychologists in our method. Then the key is the use of our app with the different programs, Power of Emotions, to reduce stress, anxiety, depressive moods, and strengthen self-confidence and trust. We have our mental sleep training to sleep better. We have also the emotional kids training for the same reasons as for the adults. And we have our mental weight loss training. And what we created newly was video masterclasses. I don't know if you have watched masterclasses before. It's like 15 minutes videos or 30 minutes videos on specific topics where you really learn the method, learn about the brain and emotion science, but with nice pictures, nice visuals, nice music. So it's also entertaining to look at it and learn something as well and do something good for yourself. And I brought you a trailer of our, okay, you will play it. I hope the sound works. It's in German, but with English subtitles.
Von Psychologen gibt es 2 aktive Seiten unseres Gehirns. Die emotionale, die rechte Seite, und die rationale, die linke Seite des Gehirns. Welche Seite hat mehr Einfluss über unser Leben? Wir können das, was in der Vergangenheit passiert ist, nicht verändern. Aber wir können die eigene emotionale Bewertung zu der Situation verändern. Können wir also auch negative Erinnerungen einfach neu verdrahten und neue positive Verbindungen in unserem Gehirn bilden? Und genau das ist der Kern von Lumios. Wir wollen dich an deine Gefühle bringen. Also, komm mit uns auf die Reise in die wunderbaren Landschaften, wo unsere Harmonies spielen, um dort die Energie und Kraft der großartigen Natur zu erleben, Urvertrauen und Freude zu spüren, pure positive Energie zu tanken. Darum haben wir in der Lumios-App wunderschöne Musik mit Symphonieorchester aufgenommen, die eigens zu den Texten komponiert wurde. So machst du aus dem Zuhören ein tiefes, emotionales Erlebnis. Denn stärker fühlen heißt stärker leben. Hallo, mein Name ist Verena Herzog-Pohl. Herzlich willkommen zu meiner Masterclass.
Institutes jeweils aufgeführt.
Thank you. Hope you could understand a little bit while reading the text. So we really give something to the people after work. They can watch and not read about like brain and emotion science. It's a very heavy topic, and we want to make that a little bit more fun, a little bit more interactive, so the people really learn what we do. And what are the benefits for companies if they want to provide that for their employees? We see that there's an it increases the employee care, obviously. It gives your employees a positive behavioral change and also an increased motivation. People who feel good, who are energized, they're motivated. And it also creates a much better working atmosphere with all the colleagues because if the people feel good, are happy, then this is the whole atmosphere changes. It also gives a positive impact for ESG criteria. It decreases sick days because happy hormones, positive hormones, are a boost to your immune system, and increases productivity because you concentrate better, you are very energized. And for your employees, it gives them more inner strength, more resilience, increased concentration, self-confidence. They feel better like in total, and it gives a positive effect on their environment, not only work environment, but also on their private environment. And they can use it 24/7, wherever they are, whenever they want to, whenever they need it. And they also can speak to a certified coach. So thank you very much for listening. I would love to support your employees together with us to be happy and healthy and to unveil their full potential. Thank you.
Thank you so much. So each of the startups gets about 10 minutes or so. Time maybe for just one question from the audience. Any questions? Yes.
Herzog?
Yes, that's my
Herzog
last
method.
name.
Right. So how are you sort of, I guess, validating the Herzog method, which is essentially how you guys are doing it, right? You're just giving it this nice name.
No, so my mother works with this method since 20 years, and she had over 300,000 patients during her time. We have no clinical study, we just have the pilot study from the Max Planck Institute, and we would love to do clinical studies or bigger studies, and also looking for cooperation partners. If there's anyone here who would like to discuss, that would be great, because we'd love to have more numbers, more proof. We just have qualitative questionnaires and letters from people where it really helped well.
Okay, thank you so much, Marina.
Thank you.
Thank you for coming and sharing your ideas with us.
Thank you. Thank you very much.
Hi, everyone. So, just for a moment, if you could think about a paramedic who has had a call to go out to a road traffic accident. Their adrenaline goes up. They know what to do. They go and they do their job. And after they've done their job, their adrenaline comes down just a little. And what they've witnessed has had an impact on them. They've been emotionally wounded, although they may not even be aware of it yet. Our app is there for them, called Mind Yourself. They may only have a couple of minutes, but there are things that they can do using our app to help them regulate and come down under 5, 10, 15, or 20 minutes. My name's Jan Smith, and we're Mind Yourself, and we launched our first version in summer just gone. So our ambitious vision is to optimize the mental health of 150 individuals by offering evidence-based solutions. And how we do that is we're in phase 1 right now, so version 1. And we do that through offering evidence-based strategies using CBT, so cognitive behavioral therapy, acceptance and commitment therapy, and dialectical behavioral therapy that people can apply in under 5, 10, 15 minutes or longer, that helps them regulate and come back to a more rest digest state. And the range of tools are from anxiety, depression, and we also then support people if they are experiencing low mood. And there is a section in there for situations. So this is specifically, we know that women, those from diverse ethnic communities and newly qualified and student are most adversely affected. And so there is content in there specifically to coach them through situations that they encounter, but also there's general information there for any health and care workers. So for example, if care hasn't gone as expected, there are ways that coaches the user and individual through that experience to help them manage their mental health so that it doesn't escalate further on that scale. As I say, we're in version 1. We have about 1,400 people using the app currently. It's a B2B model. So it's universities, it's organisations and healthcare workers. And we've got really promising data that is showing that after 1 month of use, this is really supporting the mental health of health and care workers. And where we're looking to go to next is we've just applied for some grant funding because we want to make therapy available for all, irrespective of cost and also accessibility. So Mind Yourself is a sister company to Healthy You Limited, which is a psychology organisation where we have a large pool of therapists and psychologists. And so what someone would do if they wanted support for therapy is they would go onto the app. The app would match them with a therapist or psychologist. They could either see them virtually or talk to them on the phone or text. And we're also piloting machine learning where they can also receive support that way. So what we do know is that a large barrier to uptake, so reaching out for support, is that people feel stigmatized and they don't necessarily want it on their records, or they feel that it's going to impact on their career progression in some way. And so this is a very subtle way for them to still get the support. How we started this, so during the pandemic, my background, I'm a psychologist. I've worked in this space for just over 15 years. And like lots of clinicians, I wanted to do something to help. And so set up free drop-in sessions for any healthcare worker where they could come, share their experiences, and I would give them practical strategies to help them cope, manage harrowing situations. That carried on for 18 months, and while people came, they'd say, Jan, would you write stuff down? And so I can share it with colleagues, which I did. And then I wrote some books, which became really influential. And then NHS England commissioned us to roll it out to thousands of healthcare workers. So during those workshops, we collected data to ask health workers what resources they'd need to help their mental health. And they came up with an app. This is a new world for me. I'm not tech, I'm a clinician, and I am on a really steep learning curve. And lots of the users are giving us really great feedback to help us make this a really accessible and really great product, I guess, for them to really support their mental health and prevent it escalating on that scale. So we're really in that prevention space right now. And where we're hoping to launch in the next year is in the intervention space. We're on stand M16, Shazma, myself. Please come and say hi and have a chat. And our contact details are up there, so feel free to reach out. Thank you.
Great. Thank you so much. Again, time for one question from the audience, obviously very early in their journey. In terms of what's available. Any questions from the audience?
Thanks very much. Really enjoyed your talk. I'm from Mind, and we have a blue light program. I just wondered if you have any evidence base for the efficacy of your app?
So the strategies that incorporate in the app are all evidence-based, which we've done all the evidence for that. And we have a pilot data, so we have the pilot data from the app, and we've also put in for funding, so we should hear this week or next week for a large evaluation with a university that we are collaborating with. Yeah.
Hello, hi everyone. My name is Stephanie. I'm the CEO and co-founder of Moonbird. Moonbird is a health tech company founded in 2019, and we exist to help people use their own breath to help them decrease stress levels, burnout, anxiety, or insomnia. And you might think, breathing, do I also need to work on that after working out, changing my drinking habits, eating differently, and so on? Yes, that is actually what I'm saying. But luckily, it's less intensive. You don't have to wear special clothes. You don't have to starve yourself. You can actually use your own breath wherever you are, whenever you need it. And we're here to guide you to do that. On average, 30% of the global population suffers from stress, anxiety, or insomnia. So we're targeting a huge target market. And science has shown that when you decrease your breathing rate to about a third of what you normally breathe, you activate your parasympathetic nervous system, you activate your natural relaxation system of your body. So this is a very elegant solution to calm yourself down. Now, that might be true, but it's difficult to do that on your own when you have a panic attack or when you're lying awake in your bed, which is why we developed a physical tool that guides you to do these breathing exercises. So Moombird is the world's first handheld breath pacer or a breathing guidance tool. It expands and contracts in the palm of your hand, giving you a rhythm that you need to match with your breathing. So you breathe in when Moombird expands, you breathe out when the device contracts. There's a heart rate sensor incorporated in the device, so you can see the biofeedback of these exercises on your body, so how your body is responding to these breathing exercises. See the HRV, your heart rate. And yeah, it's very intuitive. You don't have to think or count anymore, you just breathe along. You can use the device standalone when you're lying awake in your bed, as I do every night because I used to suffer from insomnia. Or you can combine it with an app to check the biofeedback, to listen to audio guides. We got CBTI audio guides included in there, and to see statistics, so how you're improving over time. We have patented the device. We have trademarks in place. We've sold over 10,000 devices in less than 12 months in our home market, Belgium and the Netherlands. We're now expanding to the UK and Germany. And we've built a network of coaches, psychologists, breathing therapists, and so on, surrounding Moombird to get the product to the right people in the right manner. We've done research. So we tested the product in 40 people suffering from insomnia. We saw significant improvements when it comes to sleep quality and restfulness during the day. And this is our lovely team. I'm doing it together with my brother, who's my co-founder. We're 10 people on average. And so, yeah, in less than 1 year, we've sold 10,000 devices, over 10,000 devices, actually. This is my brother. And yeah, if you are still looking for a Christmas gift, this might be the perfect gift for your loved one. And if you're interested to hear more, we're downstairs at M17, so please feel free to reach out to us.
Great, Stephanie, thank you. We have time for one question for Stephanie. We have a question over there.
Hi, Stephanie. It looks like a beautiful product, and obviously a lot of money goes into investing in producing products like this. But most people who work in mental health care are very concerned about health inequalities, and the price point is very high. Have you considered a different model?
Good question and fair point, and I would love to see it differently. Unfortunately, our price is correct for us, otherwise we as a startup could not exist. We have different schemes in place that allow you to pay you per month as well. We don't have a rental model in place yet, but like you can pay in slices. You can also try the device first and only pay when you like it. And we will be reimbursed in the Netherlands by the largest health insurer there for 50%. So we're looking for the right partners or clinical ambassadors to set up pilot studies in the UK as well, so that eventually we might be reimbursed by the NHS as well, because that would decrease the out-of-pocket price, and that's what I really want.
We at Mind would be very happy to help you with that.
Yes, please.
Yeah, you should absolutely get together. That's the whole point of this conference. Can I have a feel of that? Have you got it? Can I just try it? How does it work?
So you put your thumb on the device, you give it a little shake, and then after a couple of seconds it will start to expand and contract, and then you mimic this with your breathing.
That's good. Would that be useful for long COVID patients? I'm thinking actually, because we struggle to manage long COVID. The breathing exercise, maybe that's another part of it, maybe.